Hi, I'm Roland Kroukamp. I'm a family physician by trade, but I've got huge interest in sports medicine. So I've done some postgraduate training in sports medicine. And my day-to-day job basically involves seeing clients in a primary healthcare setting, whether it's from an MSK perspective or just in a general medicine point of view. I recently did a ultrasound course in musculoskeletal imaging, and that was towards the end of last year, and that completely opened my world in terms of diagnostic possibilities. The difficulty that I had was finding a device with which I would be skilled enough to be able to pursue those diagnostic possibilities. I've looked at a couple of devices on the market currently which were completely out of my price range because they're so extremely expensive. So I stumbled upon the U-Image, which I was introduced to by a couple of colleagues. I eventually managed to get the device and start using it. So for the last 6 months, I've been using the U-Image ultrasound point of care device, and it's definitely made a huge difference to my day-to-day practicing in a clinic setting specifically. It's always nice to have the skill to be able to ultrasound, but if your tools are to the extent of performing it in a very simple way, it makes your life much easier. In terms of its capability, for me, I use it when I insert suprapubic catheters, when I want to aspirate a joint, or I need to inject a joint with steroids, or if I see someone with a musculoskeletal injury, it can be a muscle tear, or other conditions that I've seen in practice since I've started using the device for the last 6 months has been conditions like plantar fasciitis. I've seen trochanteric bursitis. I've seen Achilles tendinopathies, as well as other musculoskeletal problems. If you are comfortable using the device, it just makes your life so much easier. I end up sending less clients for X-ray imaging because I can make the diagnosis there and then, and hence the idea of a point of care device. And to be honest, I use the U-Image probably more than what I use the stethoscope. And it's actually mind-blowing if you think about it. It's a primary healthcare setting. You basically mainly see clients with chronic disease. So 6 months down the line now, I can confidently say that I need to have it with me every day to perform imaging should I need some confirmation or exclusion of a diagnosis.